I'm about to do something I've never done before. This is a story about someone going to acupuncture and then a medical doctor and having bad experience with both. If you've never watched Dr. Mike's account, he's amazing. I love him. He's an MD from New York and has great educational videos. This is his experience, and what I'm going to do is react to his story and give the perspective of an acupuncturist regarding what happened to him. So I'm going to put that video on, I'm going to pause as we go and really give my opinion on what happened to Dr. Mike, which I absolutely love, by the way. I love his channel. So this is not a criticism, this is just a reaction for us all to learn this lesson that he experienced and what not to do in the future as practitioners.
I'm about to tell you a story about an injury that I had that then got worse from a medical error, then got worse with the worst medical encounter I've ever heard of. I developed a medial epicondylitis, which is known as golfer's elbow. And I was like, no big deal. A little physical therapy, a little icing, maybe anti-inflammatories, and it will go away. I constantly noticed that the pain was increasing. So while doing physical therapy, the pain never went away. But I knew once I would have some time to relax, that I would eventually go do either a steroid injection or perhaps try acupuncture. I'm very much evidence-based in medicine, and while the evidence for acupuncture isn't great.
So although I love Dr. Mike and I know he really enjoys acupuncture, the evidence about acupuncture isn't great. I'm gonna have to challenge that because there's a lot more research in a lot of countries in the world, not all translated, in studies that shows evidence-based that acupuncture has great relevancy and great effect on many disorders. I will put below this video a bunch of links to show you all the studies that you can look up that actually show amazing results using acupuncture. So I have to challenge that on Dr. Mike's video. Let's continue.
Usually it's a low-risk tool that could potentially help in a lot of cases. In fact, I have a torn labrum that I've had ever since I was like 15, 16 years old from working out improperly. I had 2 sessions of acupuncture on that completely went away, even though it bothered me for years. So I've had a good experience with acupuncture. Find someone reputable in the city, find out that they're good with sports, go to the session, very professional session. He explains that he's seen this a lot in fighters because we're constantly trying to keep our wrists straight like this, which means that there's a lot of flexion, especially when you make contact against something heavy. He knew what he was talking about, but was not overly confident. Not like, oh, we're definitely gonna fix this.
So it seems that the acupuncturist he found was reputable, was qualified, and this is really important. We need to look for qualified practitioners, and each country has different regulatory body that you can look for a qualified person. And if you're watching this and you have not gone to school for acupuncture, just so you know, we usually attend school, depending on the country, between 3 to 5 years. I did a 5-year doctorate program. So it's not like we just learned this in 2 weekends. It's a very in-depth education to be able to treat people, to insert needles and know your anatomy very well. So I'm glad that he was looking for a right person, reputable person. Also, obviously, the practitioner was great. It wasn't telling him, hey, we can cure everything and anything. He was like, I'm not too confident, but let's give it a try. That is the right approach, in my opinion.
And I think that's something important to look out for when you're going for a first-time medical visit. Did the acupuncture treatment. I was sore, incredibly sore the first day, because he had a unique style of using the needles. Like he would twirl the needle or maybe even flicking the needle. Again, a technique that I've never seen before.
It's important to notice that every practitioner has had different training from different people, and Chinese medicine is not one way to do things. So some practitioners will manipulate the needles, like you were saying, flicking, twisting. This is manipulation and stimulation of the points. Some practitioners do that a lot, some don't. Everybody is different in the way they treat, right? Sometimes we put electro-stimulation to stimulate the area. Sometimes we just let the body self-regulate without doing anything. Everybody is different, right? So that's also something to look for as well. It doesn't mean because someone did something different than what you had before that it's right or wrong. It's just a different approach. Like any medical system, there's always more than one way to treat someone.
After the soreness went away, the next day, my pain and symptoms that were there for 8 months prior went down like 80%. So it basically became unnoticeable unless I was doing something really strong. And I was like, wow, this is amazing. Again, from just one time, one session doing acupuncture, my pain is gone.
I'm so glad that MDs and conventional medicine doctors do give acupuncture a chance. And you could see Dr. Mike's experience was amazing and he really enjoyed it, benefited from it. So obviously he was going to try it again.
But it doesn't end there. I had scheduled a second session at his recommendation, and then I developed the weirdest set of symptoms that I've ever had in my musculoskeletal system. And it's because I developed true nerve pain. When the acupuncturist was doing the acupuncture, it seems like he either hit my nerve or created some sort of scar tissue around the nerve that whenever I reached for something away from my body and there was tension placed on the skin, this area of my arm lit up as if someone was holding a lighter. But then when I would press on the area, there would be no pain. It's not like I had an injured muscle or bone or some kind of tissue here. Went back to the acupuncturist because I sent him an email and he said that he could fix it. Didn't fix it, probably just aggravated it further, to be honest. I wait a week, I wait 2 weeks, not going away. And honestly, I boxed through it. It doesn't hurt normally. It's only if I make like a really exaggerated movement. And as I did that, I noticed that the nerve pain would get worse over time. And I was really getting concerned, am I doing permanent damage to this nerve?
So what I think happened there is the acupuncturist did hit the ulnar nerve, I think, where it's located, probably did small intestine 8, and it might have hit the ulnar nerve. We don't know what happened, we can't know what happened, but obviously this could be a potential depending on the thickness of the needles that the acupuncturist use. That could be the case. Like Dr. Mike said, could it be scar tissue, nerve being hit? But obviously his pain was nerve related, right? And like he said, the pain was gone, the muscular pain was gone, but the nerve shooting pain was still there. So he wanted to fix that, and I understand why he didn't go see the acupuncturist again, because he was getting so much better and then he regressed. And that can happen sometimes, usually with overstimulation. So I'm really sorry he had that experience, because it led to the next story, which wasn't better. It was actually much worse. Well, let's listen to what he has to say.
So I said, you know what? I'm gonna find the top nerve specialist, pain management specialist in New York, because what my theory was, if that nerve created some sort of adhesion to the skin through scar tissue, maybe a hematoma, like a little bleeding that happened when you put the needles in, or maybe a neuroma formed, there's a procedure that you can do called the hydrodissection of the nerve, where you actually inject near the nerve under ultrasound guidance and put in liquid in there. It doesn't even have to be super medicated liquid, and it opens up the nerve and frees it up from its adhesions. So I got this specialist, found the best one with the most 5-star reviews, had a legitimate website, good medical background, made TV appearances that I watched a few years ago that I thought were really good. So I called, scheduled, made the appointment, cash only, by the way, which is a little ridiculous, but I was like, fine, I'll pay the consultation fee. Very expensive. It was ridiculous. It was like $600. I said, you know what? This is really important. It's my career, boxing. I need to figure this out.
This is interesting because it's cash only and it was $600. That is really expensive just for a consultation, not even a treatment yet. So, you know, when people complain that acupuncture costs money, acupuncture is very safe, very effective. Yes, things can happen. We saw this with Dr. Mike, and people can bruise, there can be bleeding, there can be side effects. Like any other medical system, it can happen, but it's very, very rare. And the cost is very low compared to specialists like the one he found.
The doctor does not look like his picture. He looks like something happened to him with his health. In his picture, he looked very fit, just significantly younger. It looks like he's confined to his chair. He has some sort of very coarse tremor where his hand is consistently moving as he's talking. And at times he was even mumbling where I couldn't understand the speech that he was presenting to me. And I said, okay, this is no reason to jump to conclusions here. Maybe something happened with his health, but he's still a great doctor. Look at these reviews. Let's have a conversation and find out. So I sit down, we start having what I thought to be a conversation. And I tell him that this happened about 2.5, 3 weeks ago. And from then, he just talks for like 30, 40 minutes about potential treatments before examining me. before asking any real questions about the details of what happened or what symptoms I'm experiencing. And already was recommending injections of an antidepressant into my arm. He also recommended PRP as an option. Doesn't have great evidence for a lot of the things that we currently use it for. So I asked, like after 40 minutes of talking, and very difficult to understand him, what my oral treatment options were, if any.
So again, there was a lot of red flag, and as a patient, sometimes we feel like we should just listen to what the doctor has to say. Dr. Mike is a doctor, but he goes see a medical specialist and he's listening, he's staying, even though in his gut he knows something is not right, this is not feeling right. Always listen to your gut. If the practitioner doesn't feel right, doesn't matter if it's complementary medicine, if it's acupuncture or medical doctor, if it doesn't feel right, then we should really raise our concern right away and maybe step back, right? So that's a good lesson as well, I think.
And he basically said that I was going to get fat if I took any of the oral options. And I found that to be very aggressive and a strange comment to make because I didn't even know what oral options he was considering or what he would do. So he kind of shut that down right away. He said, but I want to do an ultrasound. I said, I'm fine to do an ultrasound, but watching him perform the ultrasound, he was unsteady. His tremor was preventing him from getting a clear image. There was like reads being done of the ultrasound that I understood that I thought were really highly inaccurate or poorly explained to me as a patient. And the ultrasound was done in the wrong portion of my arm. He then changed the treatment plan completely. He didn't really ask where my symptoms were. He just started looking at my elbow.
Wow, so this really wasn't good, right? The ultrasound wasn't done properly. The practitioner was not stable, was recommending treatment without discussing options. The communication wasn't great. That is not a great experience. I totally understand where Dr. Mike was like, what is happening? But wait, it gets better or it gets worse.
Another thing that stood out from the visit was he told me another patient's case, said the full name of the patient, said their age. These are all privacy matters that should never be discussed with another patient.
What? Okay, this is the worst, right? Confidentiality. We're not discussing any patient's name, age. This is all private. The disclosure there blew my mind. So that's something for every practitioner out there. Please do not ever do that. And that should not be done on any circumstance ever.
This doctor didn't do a history, didn't do a physical exam, recommended 2 treatments, changed it to a 3rd treatment. This is all for cash. The doctor does not look like the picture. Like, I didn't know what was going on. And now I understand why people don't speak up in stressful situations because I genuinely didn't know what was happening. I thought it was like an episode of Punk'd. That's how bad it was. It was probably my weirdest, worst patient encounter I've ever seen. It was scary because I could see how if you don't have a medical understanding of what he was saying, there could be some situations where you're like, oh, well, this person's a doctor, they have a license. But man, how scary is that? He could have, if I would have let him, injected me with antidepressants for huge sums of money with no real explanation as to why it should work.
His experience wasn't great for the acupuncture, obviously this time, which he had great experience before, but this time wasn't. However, the medical doctor was way worse, in my opinion, with all the things that he did or didn't do with the issue that Dr. Mike presented.
I ended up finding 2 case studies online of people who had nerve damage due to needles, and they had similar symptoms to me, and they did well with some oral medications, including prednisone. So I ended up using that for a period of a week. My symptoms got a lot better. They're continuing to get better, so I'm slowly recovering. So the acupuncture worked. How interesting is that? Like, the acupuncture gave me this negative outcome, but it solved my initial problem. But all that really goes to show is a few key takeaways.
When an acupuncturist punctures a nerve with a needle, if it's a small, minute nerve, the pain might be there for a few hours or a couple of days. If it's a bigger nerve, like the ulnar nerve, it obviously lasted for weeks for Dr. Mike, right? But it slowly got better and better. Obviously, he also did take medication and try to heal the area as best as he could on his own. However, those nerve pains should heal on their own. It's just very, very unfortunate this happened. So listen to his takeaway because they are absolutely on point.
One is you have the right over your body to accept or deny treatment. So if any doctor or medical professional is making you feel uncomfortable, do not be afraid to say no and advocate for yourself. You don't need to get any procedure. Or if you don't understand a procedure, stop it. Don't get it done. You need to adequately be able to assess risks and benefits. When you're going to get some sort of alternative treatment like acupuncture, acupuncture, no, that is not 100% safe. Frequently I talk about acupuncture and say, it's safer than the surgical option. So if you could avoid surgery, it's better. That does not mean it's 100% safe. Clearly, it helped my original problem, but then it created a new one that has been a real big pain. I think it's like the saying that Paul Offit said on this channel. He pointed out that anything that has evidence to work or is proven to work also has to have negative effects. Because if it doesn't have negative effects, that means it likely doesn't do anything in the first place.
I agree with all his takeaways. What do you think about his experience? Leave your impression in the comments below. Like I said, I've never done a reaction video before. This was my first time, but I figure it should be addressed because sometimes I think that either acupuncturists or the conventional medical profession, are not aligned, but sometimes one or the other has side effects, or in this instance, the medical doctor was not really doing a great job and was very unethical altogether. So I think those takeaways are important for us to learn our lesson, and I thank Dr. Mike for this video because it was amazing, and it's really important because he loves acupuncture. I can see that. And sometimes, yes, there is side effect with any medicine. You can feel fatigue after acupuncture, or you can feel dizzy sometimes. So thank you, Dr. Mike. And let me know if you want me to do more reaction video like this, because I've never done this. I'm Clara from AcuPro Academy, and if you don't know me, I create Chinese medicine and acupuncture content for students and practitioners. I am a licensed acupuncturist. I'm here to educate the world on the amazing benefits of Chinese medicine. Have a fantastic day, and no matter what, keep rocking it using TCM.